This series is brought to you by Abbott. Welcome to a special series on HealthWise titled #Matters of the Heart as we celebrate World Heart Day on 29th of September. As awareness about chronic conditions like cardiovascular disease grows, it's essential to understand how we can prioritize our health in today's busy world. With the increasing prevalence of lifestyle-related health issues, empowering ourselves with the right information is more important than ever. How can we manage our health without sacrificing the activities we love? When should we seek medical advice? What lifestyle changes can make a difference? And what new technologies can support our journey? We are joined by expert Dr. R.K. Jaswal, Director and HOD of Cardiology, Fortis Hospital, Mohali, who will help us navigate these important questions and shed light on cardiovascular disease in various age groups. Thank you, Dr. Jaswal, for sharing your valuable time with us. And let's dive deep into the questions.
Yeah, sure.
Dr. Jaswal, it's World Heart Day. Can you explain what are cardiovascular diseases in general and what are the types and causes of blockages that lead to heart attack?
Okay, fine. As far as cardiac diseases are concerned, there are multiple parts of the heart which can be affected by pathological process. So you can have heart muscle which can be involved, like cardiomyopathies or hypertrophic situations. You can have pericardium or what we call जो झिल्ली होती है हार्ट के बाहर, उसमें अगर कोई इन्फ्लेमेशन या थिकनिंग है उसे पेरिकार्डियल डिजीज कहते हैं. Thirdly, valves जो हैं हार्ट के, which direct the blood in the right direction, right? So they are all one-way valves, right? So they help the heart give blood to the lungs for purification, and then after that, the lungs send the purified blood to the left heart, which again sends the blood into the circulation. And this is a very well coordinated, function of the heart. And before we start this topic, we must understand that heart is one organ which doesn't sleep, which doesn't take rest. It works 24/7. Right from the time we are at embryo stage till our last breath. So heart is a tireless organ. So it's very important that its function should be in very good shape. At the same time, its function is so vital. This is the central station which gives blood, oxygen, nutrition, everything all to our entire body, including our vital organs. Therefore, this is called the central stage of the body. Anything going wrong there, every organ suffers and the patient cannot live without a heartbeat. So, most important and most common disease, apart from what we discussed like congenital heart disease, muscle disease, pericardial disease, valvular disease, most important and most common is the coronary artery disease. What are coronary arteries? Coronary arteries are the vessels or supply lines of blood to the heart muscle. And heart requires a lot of blood. Why? Because it's a metabolically very active organ. So muscles need oxygen, nutrition all the time, even when we are sleeping. So the first arteries from the main line, which is called aorta, which originate and supply any organ, is the heart itself. These are called coronary arteries. Now, unfortunately, if there is any disease involving the blockage of these arteries, then obviously the blood supply to the heart muscle decreases and the heart pump function starts suffering. Another aspect is, many times the blockage is not very critical. Suppose blockage is 50%, 60%, 70%. Then at rest, there is sufficient blood to the heart muscle and the heart is perfectly fine. But when it needs to work hard, its own blood requirement also increases, like one is doing exercise or one is having some kind of emotional stress. So any stress on the body requires more blood, so it automatically reflects into the heart function, right? So at that time, the blood supply may be less.
Dr. Jaswal, cardiac problems affect people of different age groups in different ways. We hear a lot of heart attack incidents in young adults these days. Is it really an alarming situation for us?
It is absolutely an alarming situation. You see, one thing is that among Indians, the heart attacks occur about 10 years young, earlier, compared to the Caucasians. So what I mean is, normally Western teaching is, if you have a heart attack below 40, probably the diagnosis is wrong.
Yeah.
In India, 25% of the heart attacks, they occur in the people below the age of 40. Again, they say before 55 years of age, heart attack is rare. Indian data says 2/3 of the heart attacks, they occur below the age of 55 years. So this is very important that we are moving towards younger age group as far as heart attacks are concerned. Every life is important, but when a young person suffers heart attack, he is in the peak working years of his life. He's most useful for his family, most required by family. In fact, he's the bread earner. And at the same time, he's most valuable for the country also. And to lose a person at that age is a big, family loss as well as national loss. So that's why I would like to stress that don't assume that because you are young. I have treated patients who were in their 20s and 30s with major heart attack. So it all depends upon the risk factors which these people have. One of the reasons, of course, when I said that we suffer heart attacks about 10 years earlier than the Caucasians, the reason for that is the genetics. Southeast Asians and Africans, they have more incidence of heart disease, and at the same time, it happens earlier in these ethnic groups compared to the Caucasians, right? Second most important thing is the lifestyle, today's competitive world. Desk job. The young man is sitting for hours together in front of the laptop and just working on the laptop, hardly any physical activity. And it is a performance guided work. Perfectly, a lot of stress throughout, right? Third, habits. Food habits have changed. So if you take unhealthy food which is rich in trans fatty acids like fast food, fried articles, your namkeens, right? Or you take, more of sugars, which is very common these days, right? White sugar is very, very harmful. We call it white poison. It hurts so much, right? So long hours, sedentary habits, overweight, smoking, alcohol intake, inadequate sleep. You may be working till late at night. This is another reason why young people have more heart attacks. And another important thing is, in young people, particularly we Indians, there is a very high incidence of metabolic syndrome. Metabolic syndrome is the central obesity. When your waist circumference is more than 36 inches in a male and more than 32 inches in a female. Very strict criteria. This is the major criteria for diagnosing metabolic syndrome. Plus 2 minor criteria like borderline hypertension or little cholesterol high or little triglycerides high. So if any 2 of the 4 minor criteria and 1 major criteria is there, one falls in the category of metabolic syndrome. And how common is it? 40% of the adults below the age of 40 years in India have metabolic syndrome. It is so common. So if you have that kind of body structure, you are more prone to hypertension, high cholesterol, diabetes, heart disease, strokes, and the incidence is you are 2 to 5 times more prone to all these problems compared to a person who is thin lean. So if 40% of the population, young population, falls in high category group, so definitely the incidence is going to be very high. Lack of activity is another factor. And another one more factor which we have seen is that younger patient people, they take their heart health for granted. So they would not have gone in for preventive heart checks, which are very important very early in life to recognize the risk factors in a particular person and then correct those risk factors, compared to elderly people who are either on cholesterol medicines or on aspirin or antihypertensive drugs for the treatment of blood pressure. That's why elderly now are having less acute heart attacks compared to the younger people. They are caught unaware. So all these factors are increasing the incidence of heart attack among younger people.
Doctor, does the heart muscle function differently for older people as compared to younger people?
Yes, I think young hearts are very elastic, compliant, but with the passage of age, heart muscle starts becoming thick, what we call as the hypertrophic. Walls become thick, heart wall becomes thick, it becomes less elastic, non-compliant, right? So it is stiff, its filling is compromised. It can lead to lung congestion, what we call as the diastolic heart failure or diastolic dysfunction. So with that, people can have some dyspnea on exertion if they walk. Similarly, heart starts getting enlarged with age. That further compromises the function of the heart. With age, the heart valves, they start degenerating and they may get blocked, particularly the aortic valve. With passage of age, sometimes the aortic valve becomes getting narrowed, and then this valve may even get calcified. And unless you replace this valve, nowadays we are using a technique of transcatheter aortic valve replacement, which is a non-surgical way to replace these valves. Now we are doing it in good numbers. So apart from that, the coronary arteries also start getting atherosclerosis with passage of time. More the age, more the chances of fat deposits and plaques in the arteries. So they also decrease blood flow to the heart muscle and further compromise the heart function. Another important thing is that the other arteries, systemic arteries, what we call, they also start becoming inelastic or non-collapsible. It's like, they do not balloon out when the blood is thrown into them. They are stiff. So that leads to afterload, and that impedes the function of heart. Makes it difficult for heart to push blood into the circulation and reach the vital organs. And at the same time, it leads to higher incidence of blood pressure. So when the blood pressure increases, that further increases the risk of heart attacks, strokes, and damage to kidney, as well as to the internal part of eye and peripheral vessels. So that is the kind of cascade which is set in with the advancing age. Heart rate and rhythm is another thing which gets disturbed with passage of time. The formula is the heart rate maximum which can be achieved is 220 minus the age. So for a 20-year-old boy, he can go right up to 200 beats per minute. A 70-year person would be able to go to maximum 150. And the basal heart rate also goes on decreasing with age. And with age, the pacemaker of the heart, which God has given us, that also starts getting dysfunctional. And one can even go into heart blocks, and this can lead to cardiac arrest. So these are the changes which happen in heart with passage of time.
Doctor, what is the best treatment at middle of a night when someone has a heart attack?
In fact, one of the angiography studies have shown that good 86% of the patients, they have either no symptoms or minimal symptoms prior to the heart attack. And among those 86% also, 68% had no symptoms whatever whatsoever, because their blockages were less than 50%. So it is not necessary that the tight blockages or plaques in the coronary arteries are the only ones which can cause heart attack. Even minor fat deposits there, they can become unstable and cause a heart attack, right? So, and 18% have 50 to 70% blockage, right? So on very strenuous exercise, they may get some symptoms which they normally ignore, that this is not the exercise which we have done. That's why, because of deconditioning, we had some dyspnea or some discomfort. But it is only after 70% blockage that definite exertional pain and dyspnea, they start appearing. So when these symptoms occur at rest and their severity is very high, or there are atypical symptoms, that pain not only in chest but in arms, or sometimes in the inner side of the forearm, or at the back, shoulders, in the nape of your neck, interscapular region, or lower jaw, sometimes even toothache. They have presented as one or two teeth, causing acute discomfort. And historically, there have been instances where the dental surgeon, he extracted the tooth, assuming that the problem is with the tooth. And actually, it was a cardiac issue. Once the ECG is done, it settles down that it is a cardiac issue. So, if there is a suspicion, or if there is a convincing suspicion that yes, it could be heart attack, you must immediately inform or seek help from the nearest hospital. But at the same time, what you can do at home is, every home must have a cardiac kit. That cardiac kit is a tablet of dispersible Disprin, 325 milligram Disprin, 4 tablets of clopidogrel, and mouth dissolving atorvastatin 80 milligram. Suspicion of heart attack, you take it, it will not harm you. But if it is actually heart attack, it's going to do a lot of good to your survival. And
Dr. Cumming, yeah, please
Yeah.
continue.
And as far as Disprin is concerned, instead of taking it with water, it should preferably be chewed, because from the sublingual space, it reaches your blood very quickly and starts acting immediately. And if sorbitrate is there, sublingual, for pain relief, sorbitrate can also be given. And another aspect which is important is, whenever there is a heart attack, good 25% of the patient, they do not complain of any symptoms. They just drop down on the floor, what we call as the sudden cardiac arrest. Now, this sudden cardiac arrest, if it is not immediately corrected, the patient will die. So it is very important to educate people to learn, how to do basic life support or cardiopulmonary resuscitation. The best thing is, in short, I will tell you how to do it. Make the patient lie down and give him a thump at the middle of chest, which is called thumb cardioversion. Many times it wakes up the patient. But if not, then with the heel of one hand put on the heel of another hand, do a effective compression at the middle of the chest, and then release about 60 beats. And after every 4 beats, give mouth-to-mouth respiration. Most of the people, they wake up after this, and then they can be taken to the hospital. Because if you don't do anything at that point of time, the person who has arrested, within 3 minutes, he'll be brain dead. So even if you quickly reach the hospital, it will be of no use, because even if we retrieve the heart at that point of time, still if the patient is vegetative for the rest of his life, there is nothing gained out of it. And at all public places, we must have external defibrillators available, AEDs, right? So that if there is a cardiac arrest, we just cardiovert it with defibrillator and then take the patient to the hospital.
Doctor, coming down to my last question, what is the importance of imaging in assessing and treating CVD, and what are the newer technological advancements in imaging in CVD?
You say imaging is the backbone of diagnosis and treatment of heart disease, right? Starting from a simple imaging like X-ray, which gives you a simple investigation gives you lot of information as to how much is the congestion in the lungs. Is the patient in heart failure or he is not in heart failure? Any specific cardiac enlargement? If it is too large, that means the heart function is not good. Right? So, and sometimes it is so bad that the pleural effusion is there. Pleural effusion is when the fluid starts accumulating outside the lung on one side and it starts looking opaque altogether. Next is echocardiography, which gives you a function of heart muscle, health of the valves. Is there anything in the pericardium? Is there any heart disease of the heart? So it gives you virtually all diseases, even congenital heart diseases, picked up by echocardiography. So basic information about all the components of heart can be got by echocardiogram. Next is your cardiac MRI, which gives you much precise. There are indications. It's not that we do everything in everybody, but as per indication, if we do MRI, it's highly informative. It gives you very good pictures of the morphology and structure of heart. CT coronary angiogram as well as CT calcium scoring. Up to few years ago, coronary angiography was the gold standard for diagnosis of coronary artery disease. You do coronary angiography, if there is a blockage, the extent and everything would be visible there. And that was the standard for diagnosis as well in dictating the treatment. How it helps us in dictating the treatment? Because, if suppose there is less than 70% blockage, that patient can be managed medically. If it is critical blockage in one of the major arteries, you can treat it with stent. And even, up to 2-3 stents these days with the help of technology, you can safely deploy and avoid a more risky bypass surgery. But then if the blockages are such that they will be best served by bypass surgery, then you advise accordingly. Okay, fine. Bypass surgery is the best way forward for this patient, right? And with the complexity of disease being treated by cardiologists today, now there is a concept of heart team. We sit together and then decide, who can give the best outcomes for a particular patient. And even hybrid, sometimes, angioplasty, if suppose that can do the best for a particular artery and bypass for others, then we do even hybrid procedures also. So that is the value of angiography. But angiography itself has some limitations. Like where the arteries branch, we call it bifurcation. There, the artery branching point may not be clearly seen. There can be foreshortening. Why? Because angiography is a 2D imaging, while heart is a 3D structure. So at bends, you might miss out certain things. Similarly, tortuosity can make, assessment difficult in angiogram. And third thing is, you can definitely make out on angiogram that yes, there is a blockage. What kind of blockage? How much is the calcium in that blockage? What is the morphology of that blockage? You can't pick up on angiogram. And these things are very, very important nowadays with the advanced treatment for coronary arteries available, that you should be able to treat calcium and the components of blockage before you deploy a stent. Because if you do it without treating the calcium, the artery will not open, the stent will not open, and that will lead to medical emergency. So nowadays we have one of the best intracoronary imaging, which is optical coherence tomography, OCT. OCT gives you colored, very high definition digital images of the inside of the artery, and it helps you doing complex angioplasty at bifurcations where two branches are dividing, major arteries getting divided into two branches and all the three are blocked, and you have to give the best treatment to that all the three lesions, then angiography will not help you. It is mandatory to use OCT in such situations. Similarly, if there is a calcium nodule or heavily calcified artery, your angiography will not help you in planning or executing your plan. OCT is something which is going to be helpful. And not only that, after you have done, you again do the OCT to find out, have you done a precision angioplasty? 30 years ago, when we started doing angioplasty, the definition of angioplasty was being able to deploy stent. Was the definition of successful angioplasty and stenting. Today, the new norm is precision angioplasty. You have to be absolutely precise by fraction of a millimeter, and OCT helps you serve that purpose. You can see that the stent is properly deployed. There is no dissection anywhere. There is no under deployment, or there are no floating struts where the clot can get formed later on. And we have seen it that if you do precision angioplasty, then it is exceptional that the patient will have any problems ever. Most of the people who think that the stents are not working, it is more of the procedural inadequacies and lack of technology which leads to inadequate results. Unfortunately, all these technologies are not available on shelf in majority of the hospitals, but I'm happy to say that in our country, in lead hospitals, the big hospitals like ours, we have everything on shelf. So whatever is needed, we can take out as per the indication and do a precision angioplasty. And they should be available 24/7 all the time, because you do not know when you will be needing during your procedure. So you cannot wait for the equipment to arrive in few hours and then you can use it. So it is very important that these advanced imaging techniques are there to help you out in doing the best service to the patient.
Thank you for sharing this information, Doctor, and useful tips with our listeners. I'm sure those who struggle to juggle managing conditions in their work are thankful for these suggestions. We have uncovered a lot of helpful insights today. Thank you again, Dr. Jaswal, for your time. We know that the cardio journey can be challenging, so we hope that today's session helps both people living with cardiovascular disease and their caregivers so that they can move forward with confidence and live their best possible lives. And thank you so much for sparing your valuable time.
Thank you. Thank you.
And for all the listeners, you can reach out to us at HT Smartcast social media handle or DM me on Instagram at Ilahi on radio. Thank you so much, sir.
You're most welcome.